Hey, everybody. You may have heard or seen our BTL bus event notification out there that is happening on April 16th. And we are proud to announce that it has sold out. However, we don't want to leave anybody out, and we want you all to know that you can call our office and get on a waiting list, or you can schedule a private consult with any of our providers.
We also want to announce that we have partnered with Repeat MD Rewards app to offer payment plans and rewards for checking in to every visit. You can go to our website and download the app and start earning rewards now.
Hello, everybody, and welcome back to another episode of Hybrid Healing Hour. Today, we're going to be talking about glutathione. And before we dive into this important amino acid and antioxidant, I want to talk about how glutathione evolved. So go ahead and tell us that, Mr. History Buff.
Yeah, so it's fascinating how we evolved as a species and how our cells evolved. When things first started out, way back in the development of cells, oxygen was toxic. Oxygen was a toxic chemical in the environment, and also when our mitochondria, which are the powerhouses of our cells, evolved. Mitochondria started out as separate bacteria on their own, and eventually they got incorporated into cells as the energy source of the cells. So when they were on their own, they would process this oxygen and create what were called free radicals. And the free radicals were then excreted into the environment. So it didn't matter that they were toxic because they weren't hurting anything. Then when the mitochondria got incorporated into the cells and the free radicals were excreted, they were actually excreted into the cells and they became toxic. So therefore, our cells had to evolve a way of clearing these things out. And that's where glutathione came in. They came up with glutathione in order to decrease the levels of the free radicals that were being produced inside our cells. And so when the mitochondria paired with the larger cells, they needed to find functions to fix problems that came on later on.
The body is truly amazing how we adapt and evolve, as we said. So before we get into this, we're going to be throwing out some words. Why don't we preface those with telling us what is the definition or what is an antioxidant? Because we will be using that word throughout this conversation.
We are. And since glutathione is one of the most powerful antioxidants, we need to know what an antioxidant is. So antioxidants are molecules that can help your body fight off harmful free radicals, which have been linked to health conditions like diabetes and cancer. And antioxidants are found in many plant-based foods. Probably the most well-known antioxidants are things like vitamin E and vitamin C.
And what about oxidative stress? What is that?
So that's a disturbance in the balance between the production of reactive oxygen species, which are the free radicals, and antioxidant defenses.
And what are free radicals?
So free radicals are compounds that can cause harm if their levels become too high in your body. And they're linked to multiple illnesses, including diabetes, heart disease, and cancer. And these are toxic chemicals. So what is glutathione? Let's talk about glutathione now.
So glutathione is actually a tripeptide. So peptides are amino acids, branched chain amino acids. So there are many different types of peptides and many different lengths of peptides. And so this is a tripeptide. That means 3. So it is made of the amino acids, glutamate, cysteine, and glycine.
And it's made in nearly every cell in the body, but it's made in higher concentrations in the liver.
And therefore, glutathione functions as the body's primary antioxidant and detoxifier. We know the liver is an amazing organ in our body that detoxifies our body in many, many different ways. So we do call glutathione the master antioxidant, and it has multiple actions.
So what are the roles of glutathione?
Right. So part of its actions, it plays an important role in maintaining the proper immune function, as we've kind of alluded to, in synthesizing and repairing DNA, and in preventing disease and premature aging.
And like we said before, if any of you took biology in college or even high school and remember the Krebs cycle,
I'm cringing.
I know, and I don't think I remember anything about it, although I know that now it's important because of the things that we're doing with some of these antioxidants and some of the things that we work with. So glutathione is an important intracellular antioxidant that helps to modulate reactive oxygen and nitrogen species, which are toxic byproducts of aerobic metabolism within the cells. And aerobic metabolism is the Krebs cycle.
Exactly. And so aerobic metabolism is what releases free radicals. And so although we know glutathione can, as we already said, get rid of those nasty free radicals that can become toxic in our each and every cell, we know even more importantly, it can directly work with getting rid of oxidative stressors such as mercury and something called POPs, which is persistent organic pollutants such as toxic chemicals. So all of this, what we're saying is it gets rid of toxins, basically, and that these are the things that cause inflammation in our body. And this can actually pull mercury out of cells and the brain. And it also plays an important role in adaptation to skeletal muscle. And so I've read how some people can use glutathione as their workout, like for a lot of athletes do this. So there's no proof though. Some people use this as, for endurance and recovery and repair, but there's no high quality evidence that supplementation with glutathione or any of the amino acid precursors that I mentioned previously improve athletic performance. Some of the cofactors for several antioxidant enzymes. So it works well with others. It likes to play well with others. So as we're going to get and dive into a little later in this podcast is how things are all linking together. It's the regeneration of vitamin C and E, as you mentioned. Like I already said, it works well with others, so it helps produce more antioxidants.
And going back to the liver produces free radicals during phase 1 liver metabolism of chemical toxins. And when it produces the free radicals by metabolizing the toxins, then glutathione comes in to help neutralize these free radicals. Glutathione also conjugates the active intermediates produced by phase 1 metabolism to make them water soluble. So once they're water soluble, then they can be excreted by the kidneys.
It also plays a role in regulation of the cellular proliferation and apoptosis, which we know is great for getting rid of the dead cells and therefore cancer prevention. We also know it plays a role vital to the mitochondrial function, as you already touched on, and the maintenance of mitochondrial DNA. Therefore, this is also anti-aging.
And if you've listened to several of our podcasts, you've heard us repeat things over and over. I mean, it's a common theme to talk about mitochondrial health. It's a common theme to talk about toxins and metal toxins and detoxifying. And all these things are tied together. So I think sometimes it's helpful to go back and listen to some of the other podcasts to see how things go together.
Exactly. So that's what we're going to touch on next is how the mercury can actually block the glutathione from being produced. And mercury is not an uncommon environmental toxin. And we're exposed to this through fish, and we're exposed to many, many other toxins. As you mentioned, go back and listen to our other podcast. But mercury can bind to glutathione directly or block the function of the enzymes that are needed to make the glutathione. And the enzymes inside the cells that activate glutathione to quote unquote reduced glutathione, which you may have seen on some supplement bottles, if those become blocked, those can cause an inefficient production of glutathione. So there's a whole cascade, which once again, we go back to the Krebs cycle, and excess oxidative stress. So oxidative stress, as you already mentioned, is from metals or even routine viruses. When your body is constantly under a battle, you are producing oxidative stress. I mean, the influenza, RSV, those are routine viruses that people get once, twice a year, COVID now. So also mycotoxins like mold and, in our office, we check for aspergillus. Those block one of the enzymes used to make glutathione.
So what does this affect when this happens?
So this affects a lot of individuals, people particularly with a low baseline or pre-existing glutathione concentrations, meaning like low levels. They are more likely to sustain the increased oxidative stress, such as the people who tend to get sick more often, and or impaired physical performance compared with those who have higher baseline concentrations. So Go ahead.
So glutathione concentrations decrease with age as well, and reduced serum concentrations are also associated with poor health. So this is also another marker of people's overall health. Some people say that when glutathione levels are low, allergies can increase. Supplementation is popular among certain people with certain medical conditions such as HIV, type 2 diabetes, cancer. Glutathione has become very popular in the last 5 years or so.
Right. I've even read a study that recently showed how glutathione can improve melasmas, which are the dark spots on your skin or darkened areas. And when people were applying a topical glutathione, it was brightening that area. I thought that was very interesting because I thought of glutathione as in many other forms, but not transdermally. And so we know there's a lot of chronic diseases and degenerative conditions that are associated with low levels of glutathione. I found something very interesting, especially because we do the preventive cardiology, is the prevention of atherosclerosis. It's very important in the metabolism of fat. And a paper from Emory published shows that a level of reduced glutathione in blood is actually a marker of predicting mortality from coronary artery disease. If you have coronary artery disease, then you and your glutathione starts to drop, your chance of having a fatal event increases. And I was like blown away by that.
Yeah, that's interesting. Yeah, you're right, especially since we focus on preventive cardiology.
Exactly. And another one that we like to focus on is Alzheimer's. So upon autopsy, they were finding that there was a missing enzyme associated with low glutathione levels, the GCLC. And back to Dale Bredesen, who has the Bredesen protocol, and he's the one who wrote the End of Alzheimer's book. We tend to reference that because he is all about detoxing the body and the brain. And so you must detoxify patients with Alzheimer's. It has to happen. If you don't, then they continue to have a buildup of toxins in their body. And a study out of Emory, once again, in otherwise healthy patients, if their reduced glutathione in the blood drops, it predicts cognitive decline. So cognitive impairment is also possibly dependent on glutathione.
As are numerous other things. So autism, cancer, autoimmune conditions, multiple sclerosis, Parkinson's disease, irritable bowel syndrome, diabetes, hypothyroidism. There's so many conditions associated with low glutathione levels or that can be exacerbated by low glutathione levels.
Unfortunately, the question then is, well, how do we test for glutathione? I want to know if my glutathione level is low. I'm sure some of our audience is asking that question right now. There is a blood test. It's a whole blood test that you can check, and it can be performed at your local lab, most likely. Even LabCorp and Quest does it. Most of the time, your insurance won't cover that. So you can always ask to check that. Now, there's another genetic testing you can do. It's called methyl genetic nutrition analysis, and that checks to see if you have a genetic mutation on the production of glutathione, as we do with some of our other genetic testing we do in our office, like MTHFR. And so I thought that was very interesting.
Right. And typically your standard medical provider probably will not check these tests or know anything about these tests. Most likely you'd have to go to, say, a functional medicine doctor, especially one who knows a lot about glutathione. So how does one get more glutathione?
Well, believe it or not, some people actually genetically make more glutathione.
And exercise. Exercise has been known to help glutathione, but there's a very fine line because too much exercise is bad and too little exercise is bad. You really have to find that sweet spot.
Right. It is known that endurance athletes can actually deplete their glutathione. And so they, going back to the muscle adaptation I mentioned earlier, sometimes you have to replenish just to get back to baseline. So glutathione's manufacture also depends on the availability of what we mentioned before, cofactors, including selenium, zinc, magnesium, vitamins B1, B2, B6, B9, and as you mentioned before, vitamin C and vitamin E. Most of these are the precursors and cofactors are easily obtained through a healthy diet. How many people eat a healthy diet and get these vitamins daily? I don't think very many. And substances such as curcumins, as we already mentioned, selenium, and N-acetylcysteine, which we have not touched on yet, and I think we will eventually have a whole nother podcast about that. It is very special. But N-acetylcysteine as well may boost endogenous production of glutathione. The exception is the amino acid cysteine. So barring several nutritional deficiencies, it is availability of bioactive forms of cysteine, which is the rate limiting factor in the body's ability to make the glutathione.
So, and there's foods that are high in glutathione too, right? They include garlic, broccoli, asparagus, avocado, spinach, all foods that are good for you, but also dairy, right? Do you want to talk a little about?
The most important factor about dairy is we know it is actually the most abundant in breast milk, human breast milk. So breastfeeding your child, and I was reading an article about this, how we used to breastfeed our children up to the age of 5, and they were getting all the glutathione they needed for their body to keep their immune system nice and high and keep a nice, healthy baby. But now we're lucky if some women can even do breastfeeding for up to a month, whether it be, their schedules or maybe lack of milk production. So we're seeing a change in illnesses in young kids, unfortunately, due to that, and as we already mentioned, autism or even leukemia. And it's really unfortunate. So it's very important to see if you can get true unpasteurized whey protein. It tends to cost more if it's done right. And what this means is it's not getting heated up in the process of making it. And so you have to make sure you're also getting the isolate version of whey protein. So you want to get truly unpasteurized isolate whey protein. And that is a way you can naturally boost up your glutathione levels versus thinking you're going to go drink some milk that you get out of the grocery store refrigerator. No, you would have to drink over a gallon of that milk to even come close to a minimal amount of glutathione.
And I know there's people out there saying, well, I'll just get plain oral glutathione supplements, but they're not absorbed very well, right? Why is that?
Right. So unfortunately, a lot of people think it might be due to the gastric enzymes that limit the action of the glutathione, but also because it can be broken down from the stomach. I mean, our stomach, that's what it does. It digests our food. So when it breaks down the glutathione in the gut, then it's broken down into constituent parts. Well, then those have to be rebuilt in the cells. And if you're lacking the building blocks or the building blocks aren't fitting together, then you're not going to be able to make that glutathione. So it's just putting the pieces of the puzzle together. And then also, I would say the best form of getting glutathione is through a liposome. I say liposome, it could be liposome because it's actually from lipid. It's a phospholipid. And think of it as a fatty bubble. And this is literally just a hub that allows it to get absorbed much better. And it's particularly to the immune cells like macrophages. And so it's great for your immune system and protection.
So what about IV glutathione?
IV glutathione is fabulous. I see people feel better almost immediately when they get an IV push in our office. And unfortunately, most people don't want to come in for an IV push every day. And so the, lifetime of the IV glutathione is not sustainable. If you want to come in just to boost your immune system, when you start to feel under the weather, that's great. But eventually, if you truly think glutathione is the answer to your problems, you probably should do the liposomal daily.
Right. And you have to remember that you also have to take away the stressors and the toxins and not just treat with glutathione. Just taking glutathione is not enough. You have to fix why the levels are low in the first place.
Exactly. And that has everything to do with the body and being able to detox. And we've mentioned this on other podcasts before. I forget the analogy that when we had Dr.
The bathtub.
Yes, when we had Dr. Huma Ali on our previous podcast. Mm-hmm. So it's wonderful. The body is wonderful, but it's not going to work if your body can't detox. So you have to fix the plumbing first. And I mean, that comes down to you have to be able to poop. You have to get rid of the toxins in your body. That's just one example, right? And so if you don't have good plumbing, or if you're extremely deficient and you start taking a lot of this, you might have side effects. And some of those side effects could be detox side effects, such as gastric cramping, nausea, abdominal pain. Some people get joint pain or muscle aches. And, there's been some allergic reactions, but this is not quote unquote an FDA approved medication. So what is an allergic reaction? It depends. Is this something you're putting on topically with lotion and you get a rash? Sure, that is one. But what people don't understand too is that chronic supplementation has also been linked with low serum zinc concentrations. And so that's what I can harp on a little bit on the side note there is just because you're taking an all natural supplement or a vitamin over the counter, it doesn't mean it's all safe. I mean, we've even mentioned before how taking high doses of zinc can deplete your copper levels. So you have to have a balance in your body. And also inhaled glutathione is an option out there as well. So that has been shown to trigger some asthma attacks.
And if you're getting IV glutathione or injectable glutathione, you have to be a little wary because the FDA has warned that glutathione powders used to prepare injectable forms may contain a large amount of endotoxins that could cause myalgias, arthralgias, nausea, vomiting, and even hypotension. So you need to know where your glutathione is coming from. Is it a reputable source?
Exactly. And not everybody can have glutathione. So as you're thinking right now, because I need this in my life, right? So almost everybody would think that they need it right now, but not everybody can have it. So there's one exception that I am aware of at this time, and that is transplant patients. So anybody that had an organ transplant or those who are on immunosuppressive therapies, I mean, this is boosting your immune system. So we cannot be doing that if you have a transplant in your body, and we are supposed to be suppressing your immune system. So you need to talk with your provider about that. And then basically the moral of the story here is when you have glutathione, your cells function better. When your mitochondrial functions better, we have more energy. It generates ATP, which is the adenosine oh Lord, I cannot say this.
Triphosphate.
Yes, triphosphate. And this is basically what is the chemical energy of our cells. And this is promoting better well-being, healthy, and I'd say a happy person.
So I'm sure you've heard a lot about glutathione already because it's one of the big buzzwords out there, but I think you're going to hear more about it in the future. And I think we're going to get better ways of raising our glutathione levels, both naturally and via artificially. So stay tuned. And if anything new comes up about glutathione in the future, we'll have another podcast on it. The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.